if yesterday's announcement bears the fruit that you're hoping, the total number of deaths, rather than being in the hundreds of thousands, could potentially get below 20,000, which is still a huge number of deaths, but is nonetheless a much better picture than many might have feared.
That is the hope, that we can get it down to that. And to put that into perspective, every year in seasonal flu, the number of deaths is thought to be about 8,000 excess deaths. So if we can get this down to numbers 20,000 and below, that's a good outcome in terms of where we would hope to get to with this outbreak. But I mean, it's still horrible. I mean, that's still an enormous number of deaths, and it's an enormous pressure on the health service. And having spent 20 years as an NHS consultant as well as an academic, I know exactly what that looks and feels like.
And just before I bring my colleague in, just one final question about what we have come to understand about the disease. Most people understand that the people who are at risk are either people with a long-term condition or older people. But in the Netherlands, we understand half the COVID-19 patients in intensive care are under 50, including one 16-year-old. Have we had any deaths in the UK from people who are young and without long-term conditions?
I don't have all of the clinical information because that's privy to the Health Department, NHS, and the Chief Medical Officer. So that's really a question for them. But it is obviously a very important thing. Most of the deaths, I know this for sure, the vast majority of the deaths in this country are people who are elderly, who've got pre-existing conditions. I can't tell you, because I don't know, whether there are any exceptions to that.
And are you aware of any doctors or nurses who are currently in intensive care because they've picked up the virus from patients?
Again, I'm not privy to that sort of information. That's something, and I know the CMO is being very careful, rightly, about protecting confidentiality of patients. But I would say that the one of the points maybe underlying the question, which I think is important, is these viral infections can adapt and change as we go along, and we must keep an eye on everything from clinical picture through to outcomes through to different ages to make sure that we're always dealing with what we think we're dealing with.